Workers are placing final touches at the Winfield Correctional Facility for the unveiling of the Specialized Care and Geriatric and Cognitive Care Unit. Once past the control center, there are no bars and no gates.
It's more of a community-style setting than it is a setting that you would see in your typical prison. It's more of assisted living with people living inside the environment, but there's a lot of activities that you would see much in a community with an assisted living setting. There's actual 5 settings. So we have one wing that's designated to infirmed care, one wing that's designated for dementia, one wing that's designated for handicapped, older handicapped people, wheelchairs, that kind of stuff, can't walk over 100 yards. Another floor that will be geriatric, that are much, able to get around like you and I can. And then a third floor, which would be care of substance abuse.
Providing proper care for residents struggling with dementia or early Alzheimer's is a growing need.
When you're dealing with cognitive care, you have all those kinds of things that are kind of on the fringe that make you kind of nervous or reserve in taking care of changing your ways of doing things. So in this environment, we feel that people will be comfortable enough. We feel our staff will communicate with them in an effective way that encourages that change a little bit more than you would in a normal prison setting.
What is also not normal? There are individual rooms of no more than 4 residents and the features of hospital beds, bathrooms with doors, showers, and even kitchens. Snyder says his team has been screening KDOC residents who are aged 50 and older who also meet custody guidelines. Starting February 28th, they will begin moving residents into the units 30 at a time on a weekly basis until the unit is full. Another unique aspect of this unit, it will provide a CNA training program for residents to help with hospice care.
We're working with the community partners at Cali County. They have a CNA program that we're actually going to train residents to work in the community in nurse care. That plan is still, we still have to work a few bugs out of it, but this is the intended workspace that they are going to work in to do this. And that will help us in the care of these residents as well. It's more of a community type of environment where they are helping their own or giving back.